65 million people worldwide are affected by epilepsy, and 1 in 26 people in the US will develop epilepsy. I'm Dr. Rani Sarkis. I'm an epilepsy specialist at Brigham and Women's Hospital, and these are my top 3 tips for staying healthy while living with epilepsy. Tip number 1, you are an essential part of your medical team. Epilepsy is when someone has repeated, unprovoked seizures, sometimes for obvious reasons. But in 60 to 70% of cases, we don't know why they are occurring. Because this is a neurological disease without a cure for some, and 1 in 3 people cannot control their seizures with medication, the information you bring to your healthcare team is essential to your individual treatment. Our brains are highly complex organs, and epilepsy can be the result of multiple causes. We have the technology to diagnose some of them, but not all of them. Do not be discouraged if an exact cause is not found. We also don't know how you will respond to a specific medication, which is why we sometimes have to try multiple medications and other treatments before finding the one that works for you. Every individual and every brain is unique. There are many studies occurring even as we speak with the hopes of finding a cure to epilepsy. Tip number 2, don't disregard symptoms you might be experiencing. Living with epilepsy means that it's important to pay attention to your body. First, when you go on medication, it changes your brain chemistry. Let your doctor know about side effects you're experiencing when trying different medications. There are many medications your doctor can try, and it's important that you stay on a medication you can tolerate that will not affect your quality of life. Second, let your doctor know about any unusual symptoms. Some people have a sensation or aura, which might be a minor seizure that could progress to a more severe one. Usually, auras tend to repeat. Make note of what that feels like. Observing seizures can give you and your healthcare team a lot of important information to help with treatment. However, because of the nature of epilepsy, an individual can rarely have awareness of their own seizures. Because of this, it can be very helpful to have someone else observe your seizures or seizure patterns, or set up a camera so you can capture them and share them with your doctor. This can help your doctor pinpoint where the seizure is coming from. Tip number 3, talk about your epilepsy. The number 1 reason to talk about your epilepsy is your safety. It can be essential to let family, co-workers, or other professionals, flight crew for example, or your dentist, know about the possibility of a seizure. The most important thing is educating the people you trust about seizure first aid. It's also important for you to create a supportive environment around you, or seek professional help if you're struggling with your disease, such as psychotherapy or support groups. Remember, living with epilepsy means taking care of yourself, meaning getting enough sleep, managing stress in your life, taking your medications, and avoiding substances that can trigger seizures, such as alcohol. Strengthening your body helps your brain. Thanks for watching. I'm Dr. Rani Sarkis. For another video on epilepsy, click here and don't forget to subscribe.